Now your breakfast is served.
Okay.
Feed your mind and the rest will follow.
You start with figuring out what does health look like for me physically, mentally, emotionally, and work really hard on being good at you.
Healthy mind, healthy body, healthy life. Soul Food on Smooth 98.1.
Welcome to Soul Food on Smooth 98.1, where we love music and we love life. It's now 6 minutes past 8 o'clock, and it's time for us to discuss your wellness. The month of September has been dedicated to aging. Now, not globally, not even nationally. It's right here on Soul Food. We've been talking about how aging affects you in different ways, from your eyes to your nutrition. And of course, when we talk about nutrition, there has to be the starting point, which is your mouth. So this morning we are discussing what aging does to your mouth, and some things that are normal, some things that are not normal, some things that you should be on the lookout for. And you know how when children eat sweet and chewing gum when they're growing, when they're small, the mom and dad will say, oh, you don't want to have teeth when you grow up. Well, is there any truth to that? We will find out. So that's what we're discussing this morning. If you want to still have teeth in your old age, the things that you should, start doing now or maybe stop doing now. And I do have my guest in the studio with me. You can join us on YouTube. That is youtube.com/, smooth 91 FM Lagos. Again, youtube.com/, smooth 91 FM Lagos. It's his second time here. I'm so grateful to have him in the studio because the rains out there are not smiling. And it's not easy for you to get out of your bed on a Saturday morning in the rains. So please make welcome the group clinical director, Beacon Hill Smile Group. That is Dr. Uku Ntekim. Good morning.
Good morning, Sean. How are you doing?
I am excellent. Thank you for being here. I'm just grateful for that.
Thank you for having me again.
Okay, so now let's dive right into what happens with your mouth and aging, just the normal occurrences, the things that when you grow older, you start to notice.
So basically, right, aging is something that I would say every human being should how will I say it now? Every human being should look forward to basically. By the grace of God, I'm 50 this year.
Ooh, have you celebrated it?
Not yet.
Oh, okay. I
It's
can't
in the
wait
works.
then.
It's in the works. So I said that to say that I look forward to 70, and that was 20 years time. So I can remember vividly 20 years ago, and now I'm 50 and I'll be 70 in 2 decades. So personally, I'm preparing for that, and the reality is that we're going to age. Things are going to change. The belly parts will increase. The skin wrinkle, things will change basically. So, and also in the mouth, changes also occur as we age.
Hmm. Okay, so what are those changes that occur? For instance, in your body, we know the metabolism slows down. Your
Yes.
skin might not be as elastic
Exactly.
as it used to be. Okay, so what are the things that happen in the mouth?
So typically, like you rightly alluded to earlier on, the things that happen but are both normal and abnormal, right? Normal things occur and some abnormal things could occur if you're negligent. Now, typically, right, as you age, tooth wear occurs. The tooth begin to wear. The wear could be physiological, the wear could be pathological. So that's typically what occurs. Tooth wear occurs as we age.
Does it become shorter or thinner? I don't know if shorter is the word, but it means you're losing the top of your enamel, right?
Yes, exactly. You're losing the enamel. So basically, as just like anything, wear and tear basically occurs. So it all depends on how much you chew. Now, Africans typically our diet is very you're laughing. Typically our diet is very rough.
Oh,
we
wow.
like tough meat. We like to chew bone. I see patients every day chewing bone, and I'm telling them, listen, the human masticatory system in this age is not designed to chew bone. Bones are for dogs, are for canines. So stop chewing bone. because the more you chew bone, the more your teeth wear away. So
Wow.
yeah, true. So that now is a pathological wear of the tooth. But that aside, as you age, right, the likelihood of your teeth wearing away, and it then depends on how much wear occur, but definitely there'll be some tooth wear, basically, yeah.
Interesting. Because I know someone, my friend, who takes joy, delight in chewing bone. It's like some sort of teeth exercise.
Well, it's hard to argue against that, really, but there's an effect to that, really. So if one, for example, chews bones, right, regularly, the likelihood is that as you age, as you go from your fifth to sixth to seventh, as you age, right, there'll be hardly any enamel left. And then what I see typically, right, is aged people in their 70s coming in with pain or sensitivity. There's actually a patient I'm managing right now. This man loves bones. If you see his teeth, all worn down. And what he needed now was a full mouth rehab to restore the teeth to how they were before. He's lost vertical dimension, everything is gone, But we tell me that, doc, no, I beg, I like my bone. So so we just have to find a way to manage it, right? So that's what it is, really.
That is very, and when I hear teeth rehab, it sounds like bring a lot of money.
It's a lot of money.
It's a lot of money.
They're talking of restoring the teeth to the right height, increasing the vertical dimension, how it should be. So I'm being technical now.
It's okay.
But it's that's what it is, really.
Sometimes now the body has a way of refreshing itself, regenerating. I wonder why the enamel does not regenerate itself.
Now that's quite interesting. I tell folks that, the human body is a powerful compensatory mechanism. It has a way to compensate for things that go wrong, so to speak. But for the animal, all the body does is to remineralize. So with saliva, as saliva is produced in the mouth, right, it remineralizes the enamel, but it doesn't restore one enamel. So it just makes it stronger as you age, but it doesn't restore the one that's worn away, so to speak.
Okay. I'm glad that you mentioned saliva because dry mouth has been associated with old age. Is it normal or it is an abnormal occurrence?
It's an abnormal occurrence, very abnormal, yeah, quite abnormal. So if you have dry mouth, it means aging is affecting the ability of the body, the salivary glands, to produce enough saliva, and then you now develop dry mouth, and dry mouth comes with so many issues, so to speak.
Or before we even talk about the issues of dry mouth, or if I think xerostomia.
Xerostomia, that's what it is. Yeah.
Now, what exactly does the saliva? What are the benefits of the saliva for you? Because some people might not, take heart to it. They might think it's just the saliva, right? It's just to lubricate my mouth. That's all. But what are the benefits, or what is the importance, the function of the saliva in your mouth?
Now, I want to bring it home. I don't make it technical. Let me try and bring it home. Now, just imagine. I'm sure every one of us here owns a car. Now, just imagine driving a car without engine oil. That engine will knock, as we say in local parlance. It will knock. I recently bought a car, and so I just recently changed my engine of my car, and in less than a month, it's producing a knocking sound. I have to pack it, but it's not because there's no oil. It's something is wrong with it. But that's by the way. But the point is this, right? Saliva is necessary to lubricate our food as we eat, so you can swallow. Saliva also helps to remineralize the enamel. Saliva is basically a lubricant, right? Okay. And saliva also contains digestive enzymes. So a lot of people don't know this. Let me adjust myself and say this.
Okay.
Saliva is so important. It is so important. Saliva I don't want to go too technical, but it contains enzymes that initiate the digestive process of food. So if there's no saliva, you have a problem. Saliva also, when the mouth is dry, right, no saliva, it enables bacteria to breed, and that causes mouth odor. So you don't want that. Saliva is very, very important. honestly.
I just had to bring that up so that we understand the miracle, for the lack of a better word, that goes on in our body and how we need to pay attention
Exactly.
so as not to take these things for
For
granted.
granted.
Because,
Exactly.
the body functions on its own, it
Yeah.
just does things. And so you think
You think you just take for granted.
Exactly.
You know?
So now, talking about saliva still,
Yes.
as you grow older, does the saliva production naturally drop?
As far as I know, I don't think so. As far as I know, I don't think so.
So in that case, you don't have to do anything extra to increase the production.
Well, so like I said, the reduction in the production of saliva is not normal, it's pathological. So if there's a problem, see your dentist and get it sorted out. But to answer your question, there are some things you could do to help, to cure, to attempt to what's the word now? Regenerate the flow of saliva in the mouth. Yeah.
Okay, so what are those telltale signs of dry mouth
Okay.
that make you know you have to really quickly see the dentist?
Well, it speaks for itself. You just notice that your mouth is dry.
Hopefully you notice.
Yeah, I don't know. If anybody who has drama will notice that something is going on in the mouth. You just feel the mouth is dry. You drink a lot of water and you just continuously feels dry. You know, anybody will know that. Yeah.
Does it contribute to mouth odor?
Oh, definitely.
Ah, okay.
Because when the mouth is dry, bacteria breathe better. When the mouth is wet, bacteria can't function properly. So when the mouth is dry, you're going to have a terrible stink in the mouth.
Mm. Let's talk about another thing that might come with old age, and you tell us if it is normal or not. Receding gum.
Aha. Now that's an interesting one. So basically, right, as we age, the body loses its elasticity. So the skin, the gums, and also depending on our oral habits. If one is of the habits of brushing aggressively, then the tendency, you're smiling.
Because have you seen some people, before I even say the way some people brush, there is this notion that I think we've been trying to correct many times here on Soul Food.
Yes.
It is that the harder your brush, the cleaner your teeth.
Oh,
that's why we have smokers brush being a celebrated thing.
I can't really understand the sense in that, because the gum is so tender, so it's a very tender tissue. So all you just need to do is to brush gently but firmly in the right order, with the right technique. And if you do that, the chances of having receding gums are reduced, limited. I've seen a patient who is 70, and this man has excellent gums. So it tells the story. He's had good oral habits for a long time, and his gums are very healthy. So that is one reason for receding gums. When you brush wrongly.
Okay. Then another, cavities, hole in your teeth.
That affects anybody, any age range. So it's not really associated with aging. Okay. So because you have people in their teens and 20s having cavities, and they need to do the needful, see the dentist and get it sorted out, basically.
Now, aside the ones that you've mentioned already, for instance, your brushing technique and any other thing, what are those factors that might contribute to, for the lack of a better word, unhealthy oral aging?
Smoking.
Okay.
Poor diet.
Can you expatiate on the poor diet?
So if you don't eat healthy, right, the chances are that as you age, you're going to develop a lot of problems, basically. So at my age, I try to eat healthy, and that has to be the goal for everybody. Eating healthy means that your chances of developing issues as you grow older are reduced. Alcohol as well. I mean, the list is, and I can go on and on.
Yes, please go on and on.
Alcohol is not, as you grow older, just don't drink or reduce the consumption of alcohol. It's very important.
Okay, so we'll take a short break, and when we come back, we'll continue with those things that come with aging, and of course, that is as touching your oral health. If you have any questions to ask or any feedback, contribution as well, observations, please send it to WhatsApp. Like Cisco Delgado that says, at this my old age, I don't eat chicken bones anymore the way I used to in my early stage of life as youth. All right, so WhatsApp is 0809 444 0981. Again, 0809 444 0981. And the call line is 01448 9981. Again, 01448 9981. We'll go on the short break, and when we come back, we'll get into the discussion of the things you should look at doing. For instance, Cisco Delgado mentioned how you no longer eat chicken bones like you used to. So as you're growing older, what are some of those habits you should be incorporating, or some things that you should drop as you are increasing in age? We'll come back to that after the short break. You're listening to Soul Food on Smooth 98.1.
Love life.
Going to,
And I'm feeling
I
good.
was going to do
You've been able to.
I was going to do my food, so that breaking at the time.
Okay.
I know I was freelance. I was just looking at my this.
Okay. What did you plan for?
No, I mean it's free, but I always like to have a guideline. I like the way it was doing, but towards the end, like I shouldn't have mentioned that.
Will be following.
Ah, okay.
So yeah, after so I didn't remember I was smoking. I was already doing on.
Okay. So when we come back, would you like to go back to some of the other things? Maybe if there is anything that was not
So
mentioned.
here again, right? I wanted to allow you to take the conversation. Asking, so I think it's better that way than me just going.
No, there is the part where you have to go. I mean, this is your field. So when we come back, will you go on? Yes.
Will be
The Locker Room on the Smooth Breakfast. Mondays, Wednesdays,
Oh yes, that
and
was going
Fridays
to be
at
part of the
8:15.
question. When you
we
use your
will be
All right, so we
following
come back.
you. Smoother than a fresh jar of sipping.
We are Smooth 98.1, and you are listening to Soul Food right here on Smooth 98.1. 22 minutes past 8 o'clock. The show is about your health and wellness, and we are talking about your teeth, your oral health, basically. My name is Oluwaseun, and my guest is Dr. Uku Ntekim. So before the break, I said when we come back, we'll go back, we'll continue some of the things that happen when you are growing older. But before then, still expatiating on smoking and the likes.
Yeah. So when you smoke, it has an effect on the gums. The gums become less elastic, and the blood supply to the gums reduce. So if, for example, you have any issue and you have to undergo any procedure, the healing rate now kind of reduces. So we always advise patients not to smoke before they come for any procedure. But that aside, smoking is a very unhealthy habit that as you age, it affects your gums as you grow older. The list is endless. The value chain it just goes on and on and on, so to speak. But time won't permit me to go into details about that.
Okay, the summary is smoking is outrightly bad for you. Okay,
So
go
another thing I
ahead.
want to mention is tooth loss. Now, you will notice that as people age, they begin to lose their teeth. That, for me, is pathological and the causes are several. It could be due to poor gum health. It could be due to tooth wear that has gone deep into the pulp, and the tooth has to be extracted. So these are things that occur during aging. So the lesson here is, as we grow older, we need to take good care of our mouth because of this thing that could happen as we grow older. Some things that happen that we do that are not really our fault. Like, for example, people can develop a cancer in the mouth, and that is not so much to be said about that. But basically, it could be due to poor habits as when we're younger. It could be due to, and it could just happen basically. So these are things that occur, and then it just goes on and on.
What about pain in the teeth? I mean, the jaws now.
I'm so happy that I'm so happy you mentioned that. Pain in the jaw. That's talking about the jaw joint.
Yeah.
Thank you so much for reminding me about that. Now, and this also can be a consequence of bad oral habits. For example, for someone who chews a lot of bone, or just has bad habits, basically, it can affect the joint. And the jaw joint, let me mention the name, is called the temporomandibular joint, TMJ for short, but we'll just call it the jaw joint loosely for better understanding. It is so important because it is the hinge that opens or allows the pathway for the mouth and food to enter into the body. So if there's anything wrong with the joints, you're in big trouble, so to speak, and that's just the truth. So we do everything possible to keep that joint healthy, and any dentist that comes that has a pain should always examine that joint, because without that joint working properly, everything else can't happen. Because how do you open the mouth to treat? How does mouth open to treat? You know, I saw a patient about 18, no, about 3-4 years ago. A young lady in her 20s, she couldn't open her mouth. I was shocked. She could barely open. I checked her joints. It was in such bad shape. I said, what do you think could have happened? She couldn't tell. And I sent her for investigations to find out, and I never saw her again. But that just tells the story. It affects everything. You can't eat, you are depressed, low self-esteem, everything. And then if I, as the dentist, wants to treat inside the mouth for any reason, and you can't open wide, it's a disaster. So it's so important, and that's I'm so good with reminding me about the jaw joint.
Well, okay, now still on that, although just a little digression. I believe it's called bruxism when you're grinding your teeth.
Yes.
That is something at first it was interesting or fascinating to me. Then at some point I was worried because I see it in people who ordinarily they're seated or their mind is somewhere or they're immersed in something and they're grinding the teeth.
So it's an involuntary thing that occurs in some people where they grind. Some do it when they're under stress. Some do it in their sleep, and that also affects the enamel of the teeth. It wears away over time. And so if someone is a bruxer and is not curtailed or controlled, as this person ages, right, there'll be little nothing left in the mouth, little or no enamel left, and then it just goes on and on. Sensitivity, pain, it could lead to tooth loss, so these have to be managed properly. When the person needs to see a dentist and manage it properly to prevent what could occur as you age, basically.
Thank you very much for the enlightenment this morning. Shouts from Lucky says, does chewing gum have negative effect on the teeth as one gets older?
It does, actually. It does, because especially if one is chewing constantly on one side. I saw a young lady, an 18-year-old lady, about 3 years ago, who came in with pain from the jaw joint on one side, and I found that quite interesting. Then I didn't know as much as I know now, right? So I kept questioning, and then I now asked the girl, "Do you chew gum?" And she just put her head down, and the mom said, I told you, don't, no gum. They're Indian, by the way, and just went on and on, and that day I learned a lot from that experience. So gum can have a good effect in terms of refreshing the mouth. But so if you have to chew gum, just chew for a little while and toss it away. But some people just go the Alex Ferguson way, with all due respect, going on and on and on and on and on and on and on.
Straight bullets.
And you don't know the damage you are doing to your teeth and to the joints especially. So you just have to be aware of that. Yeah.
Thank you very much. As we draw to the end of the program, I think we have just 1 more minute to take your calls or your messages. 0809-444-0981. Again, 0809-444-0981. I think Kingsley says, I am enjoying your program. Keep up the good job. Well, thank you so much for enjoying that. So as fast as you can, 0809-444-0981 is the WhatsApp line, while call line is 01-448-9981. So on a final note, what will be the extra addition you will, especially for those who maybe are just carefree about their dental health right now, those things that they need to be careful of so that they can have good oral health when they're old?
It is said that procrastination is a thief of time. So now that you get the message hard and hot, just see your dentist. It's so important. Honestly, just see your dentist. The time won't allow me to go on and on about that, but just see your dentist and have your teeth checked out regularly. Thank you.
All right, thank you. Hello, good morning.
Good morning.
Good morning, a lady. How are you? What's your name, please, and location? Thank you for calling. What would you like to say? Okay, I'm sure he will answer that. Thank you for calling.
Well, to answer that question, um, tooth discoloration could be on the surface or within the inner substance of the teeth. So if it's on the surface, it means there are stains on the teeth which need to be removed manually, either by toothbrushing or seeing your dentist who will do a hygiene clean or what we call cleaning and polishing on a regular basis. It should be done every 6 months. But if you have what we call intrinsic stains, those are stains that are within the inner content of the teeth, then you need to see your dentist to sort that out for you, either with teeth whitening or using prosthetic means, either veneers or crowns or anything like that. Yeah.
Okay, thank you. And I think that topic, we've discussed it before, but maybe it needs to come back because the urge to have white teeth based on societal beauty standards can be quite pressuring. But at
It
the same
can.
time, I think it is important that you do not just whiten your teeth because I think it could also lead to some tooth sensitivity and the likes, like you
Exactly.
mentioned.
So I say this right, that teeth whitening is a purely cosmetic procedure.
Mm.
There's hardly any clinical component to it. And so not everyone's teeth can be whitened. Only healthy teeth can be whitened. So if so it's that's important. I know people go to beauty parlors and do all kinds of things. I'm not judging anybody. But the point is that before you do a whitening, see your dentist. Let him examine the teeth and ensure that they're healthy enough to take whitening. Yes, sensitivity is a drawback, but if it's properly done, it shouldn't be that sensitive.
Okay, and please don't get tempted to go and buy all these over-the-counter kits to whiten it,
Oh
and
wow.
the ones they sell.
Sodium bicarbonate,
Yes,
charcoal, and all that,
please,
raw charcoal.
please
No,
don't do
those
it.
things are not good. No.
Thank you. Charles Chidozie says, "No, sir, Alex Ferguson slander will be condoned on this show."
I apologize. I apologize. I meant no disrespect. I apologize.
Please, you better go and focus on your match with Brighton before you have another arsenic situation, if you know what I mean. Dang. Anyways, Cisco Delgado says, I think chewing gum sometimes exercise the jaw muscles.
I agree. But that's why I said it should be done. Just chew your gum for like 3 5 minutes and toss it up. Don't chew on and on and on.
Yeah, Wilson said the same thing about chewing gum exercising the tooth. Okay, good. But at the same time, do not use it as an excuse. And I think the last one I would want you to say is children, and especially those who have sweet tooth, those who like some candies, like all the sweet things, and do not brush after. Yeah.
So, Oluwaseun, this is very controversial,
Okay.
and because there are two schools of thought. Some believe that children shouldn't take any sweets at all,
Ooh.
and some say, like me, I say, indulge them, let them have some, let them enjoy it, but let them brush after. It's important. Let them rinse after or brush after, but there should be some form of control at the end of the day.
Mm.
Yeah.
Okay, thank you. And we are done with the show for today. Any other questions, feedback, you probably have to take it to YouTube. That is youtube.com/smooth981FM Lagos. Again, youtube.com/smooth981FM Lagos. I don't think you're active on social media.
No, no, really. I'm too busy, but I need to up my game. I know.
I doubt if I've had yes, I've had very few medical professionals on this show who are active on social media, which is understandable, especially with the state of Nigeria's healthcare, where you have much more patients than the professionals. But yeah, okay, there's no point saying.
My new role makes me. I work like 24 for now. I know just for a while. I work almost 24 hours, so I'm seeing patients and I'm dealing with clinical operations issues, and on my phone is my second office. I'm dealing with it. So it's a going thing all the while. But I'm not complaining. I'm proud and I'm happy because I solve problems, and I find it. I like challenges, and I just talk about. I deal with it, so to speak. So for that reason, social media. I mean, also I'm a bit active on Facebook. Let me just say
Okay.
that. So I just post stuff on Facebook now and then, but Instagram not too much. Yeah.
So what's your name on Facebook?
My name is Uku Ntekim.
Okay. All right, thank you so much for your time, Dr. Uku. It's a pleasure, and I look forward to having you back again one of these days.
It's an
Definitely.
absolute pleasure. I'll be happy to come back.
All right, thank you, Lagos, Nigeria, and of course, world. Thank you for being a part of the show. But of course, breakfast in bed is not done yet. We still have the children who will come and spell, learn one thing or the other on Curious Minds from 8:40 till 8:55, and afterwards, it will be lovely music all the way. We will again save this video for you on YouTube. It is youtube.com/smooth91 FM Lagos.
And the rest will follow.
Thank you. We are
I started
done.
figuring out
Yep.
what is health
It
look like
was
for me.
lovely.
Physically,
It was lovely. I
mentally,
like how
emotionally,
conversational
and
it
work
was.
really hard
Yeah.